because we have Puan Nur Farhana. She graduated with a Master Medical Sciences Physiology from Faculty of Medicine, UITM, and a Bachelor of Physiotherapy from Faculty of Health Sciences, UITM. Formerly, she worked as a physiotherapist at University Malaya Medical Center in 2008, and she joined UITM till now as a lecturer at the Center of Physiotherapy Studies. Also, she involved a lot of academic matters, mainly in curriculum development for diploma and degree. Her research interests on women health, focusing on pregnancy and antenatal exercise. Okay, currently, she is continuing her PhD in public health, concentrating on antenatal exercise and behavioral change. So, what exercise are unsafe during pregnancy? Why it is safe to exercise during the pregnancy? Okay, I strongly believe that all these are frequent asked questions, especially for being a first-time mom. Thus, today we have Puan Farhana here to tell and share her stories and knowledge regarding this topic. Let's give the floor to Puan Farhana with the topic entitled Physical Activity During Pregnancy. Okay.
Okay, thank you, Dr. Azliana, for the short and sweet introductions. Okay, Assalamualaikum and very good afternoon to all participants from Malaysia, Indonesia, and Thailand. Okay, since my stations is at 4 p.m., so I hope everybody are still bear with me. Okay, so I will start my sharing sessions with a short quiz. Okay, so just now you have joined Dr. Ida quizzes. Okay, so now I have a very simple questions. Okay, with the Mentimeter. Okay, so give me a time to share with you on the Mentimeter. So I hope Dr. Azliana, can you share the link?
Okay. Wait a second.
All right, so this is the Mentimeter quiz. So I think for those using the mobile phones, you can enter the code. Okay, and also you can also join the quiz using the link that's shared in the chat box.
Can I join too?
Yeah, sure.
Okay, everyone, let's go. Quiz.
Okay, so I have very simple questions. There are 3 questions. Okay, so each of the questions have 1 minute and the last questions is around 30 seconds. Don't worry, you are not be display your name. Okay, just for your answer. So I really hope that everybody join this quiz. Okay, I give time. Maybe I need to give time for them to join the Mentimeter first before I start countdown. Oh, forget to share the... Okay, right. So we already have the answer before I start countdown. Okay, so we have 1 minute. Okay, right. So many answer for the major barrier. All right. Yeah, yes. Come on. Come on, everyone. Let's join to let's answer these questions. Okay, we have another 30 seconds to answer. Okay, you can give any answer, no right or wrong. Okay, so it's look like the tired is become the favorite or
Most
the
common.
major barrier. Yeah. Then pain. All right. Number 2 is pain. Okay, so we have 1 second and time's up. Okay, so overall, okay, so we have tired will be the major barriers, okay, vote by the participants. And the second one is the pain as a major barrier faced by antenatal women. Okay, we will see afterwards. I will discuss more in my presentations. Okay, we move on to next questions. Okay, so you can start answer. One motivation, so you have two choices of answer. You can answer two. I still no answer yet. All right, baby help. Okay, so, all right. So there are more coming. Okay, we have another 18 seconds. Yeah, it looks like baby health is the priority. Is the motivations for the mom to do exercise. Yes. All right. So we finish on the second questions, which the baby health and the easy birth is the motivations for the mom to do exercise. Okay, the last questions. Okay, you can answer one. The most psychological benefits of physical exercise. Okay, we only have 30 seconds, so hurry up. So where's the answer? Not yet answer. Dr. Yana, you answer or not?
Yes, but then I don't put my name.
But yes, all right. So we know that the higher, more psychological benefits chosen by the participants is increased self-confidence, and the lowest is the improved maternal self-image. Okay, we will see and we'll discuss later on.
All right.
Okay, thank you everybody to join the Mentimeter quiz. Okay, so now I share my presentations. Okay, there is some problem. Wait, I have to close this first, I think. What happened? Still have the music. All right.
Okay, Puan Farhana, I can see your slide is coming up. But then, are you there, Puan Farhana? Hello? Wait, I try to contact Puan Farhana.
Kenapa tanya question lah?
Yes, yes, the screen is freeze. I try to contact our speaker. Give her some time, okay? Hello. Hello, Puan Farhana. The IT team allow Puan Farhana to join in. Dia terlong out. YouTube. Wait, Puan Farhana. Okay, sorry for the technical problems. Just
Hello.
please stay with us. Yes.
Okay, Dr. Yana,
Puan
can you
Farhana,
hear
are you
me?
there?
Yes.
Yes, Puan
Sorry.
Farhana, I hear you very loud. Okay.
Sorry, I left tadi. All right. Okay, so some problem with my camera.
Can you open? Oh, your camera. How about your slide? Can you share
Okay,
your
so
slide?
now, all right. Okay, so now I share my slide. Okay,
I can see
everybody.
your face. No worries. Okay, camera okay, Puan Farhana.
All right. Sorry, everybody, for the technical problem.
No worries.
Okay, so we start on the sharing sessions. Okay, so today actually I will discuss or share my tiny knowledge regarding the topic of the physical activity during pregnancy, looking at the women's perspectives, okay, which enable to assist us as the physiotherapists in the interventions among the antenatal women. Okay, so all right. Okay, is my slide changing? Dr. Yana? Is my slide
Yes.
changing? All right.
Yes, currently at this
Okay. So
table
this
of content, right?
Yeah.
Okay.
Okay, thank you. Okay, so this is the content that I will cover in my presentations. Okay, so an introduction. So the pregnancy poses the unique challenges for women. So it is a period of time which the anatomical, the physiological, and also the psychological changes occur. So it is essential during this period to implement lifestyle changes that will benefit maternal and also the fetal well-being. And Phelan 2010 is also identified that this opportunity means the periods of the pregnancy is a teachable moment in a woman's life in which women are responsive to change behaviors that can benefit their health and also the baby health. All right, so as we know, the physical activity is recommended, okay, for the antenatal mothers as the benefits outweigh the risks. So the healthy antenatal mother are actually recommended to practice exercise at least 150 minutes per week during pregnancy and the postpartum periods. This is the recommendations by the ACSM and also the CDC and US Department of Health and Human Services, and also by the ACOG in 2003 recommended on the 30 minutes or more of moderate exercise a day on most, if not all, days of the week. Okay, so this is the recommendations by the internationally. And reduce the physical activity in pregnancy is often associated with the increase of maternal complications. And as we know, it's actually the pregnancy itself, it leads to the decrease in physical activity. So we want to know how to overcome that barriers. Okay, so we will discuss and share more. Okay, so what is the physical activity versus exercise? I believe that all knows about the definitions of physical activity. So it is any bodily movements produced by the skeletal muscles that require energy expenditure. In example, the recreational, occupational, household, and also transportation activities. Whereas the exercise is one of the subtypes of physical activity consisting of planned, structured, and repetitive bodily movement to improve one or more components of physical fitness, which the essential elements of the healthy lifestyle. Okay, so usually these terms is interchangeably terms that used in describing the physical activity, because in study usually you will also see that the authors will use physical activity or exercise to describe on the physical activity among antenatal women. Okay, so we move on to the intergenerational effect. So what is the intergenerational effect? Okay. So believe it or not, okay, when a woman is pregnant, so she is also pregnant with her grandchild. Okay, so how it happened? Okay, this is therefore the previous studies show that the antenatal women should become active and healthy, which includes the exercise, healthy diet, and also with a low stress. Okay, so the meaning of the intergenerational effects, okay, so you can see in these pictures where the future grandchild is also developed inside the womb with the eggs of our daughter. Okay, so the eggs are nourished by the diet and also the environment of the mother. And we move to the benefits of the physical activity. So there are a lot of benefits of the physical activity itself. So it is important for us, especially the therapists, to know the benefits so that it will help us to give an advice or to educate antenatal women to engage in the physical activity or exercise. Okay, so the number one is maternal complications. So the benefits of physical activity will lower the risk of GWG, gestational weight gain, and also GDM, pre-eclampsia, and reduce the incidence of preterm birth and excessive fetus birth weight. On the mode of delivery, actually the PA or physical activity benefit to reduce the need for cesarean sections and also reduce the delivery complications. For the pregnancy-related problems, it also may reduce or prevent the lower back, pelvic, joint pain, and also prevent or manage the hypertension, obesity, and other chronic conditions. And it also improves the stamina, muscle strength, and energy levels. And on psychological, it improves the maternal self-image, self-confidence, body image, and also emotional well-being. Okay, that thus it will improve the quality of life of the mom. Okay, what is the current practice of the physical activity? Okay, so globally, there are 60% of the pregnant women do not participate in physical activity as recommended, despite their knowing the benefits of the exercise. So it is about 15.8% in US women engaged, only 15.8% engaged in exercise during pregnancy, and less than 35% among the Australian women fulfill the recommended exercise. And for the Asians, there is no exact percentage of the Asian women involving in the physical activity. Okay, but Fatma Priya et al. Okay, reported that the Asian women physical activity during their pregnancy was significantly lower compared to before pregnant. All right. So the issues of physical inactivity. So before this, we know that the moms is reduced in the physical activity. So what is the issues if there are physical inactivity? Okay, so the first on the physical activity. So Malaysia has the highest prevalence of low physical activity among the females. So it will reflect among the antenatal women too. And the recent study by Nazato 2020, so she reported that about 60.5% of physical inactivity among the antenatal women in Seremban. And also she did mention that 6 predictors of physical inactivity among antenatal women. So what is the predictors? Number 1 is the trimester of the pregnancy itself, pre-pregnancy physical inactivity, medical problems, low social support from the spouse, and unavailability of the transport to do physical activity, and also the bad weather. So by reduce the maternal health by increasing. So with the physical inactivity, it will reduce the maternal health by increasing the number of chronic diseases, as well will increase the burden to the government in the managing of the NCD's problem. Okay, the number 2 issues is the maternal obesity. So there is a prevalence of the maternal obesity in 2015, which Malaysia was 14.6% in 2016. Okay, and it also was parallel with the figure from the developed countries. So obesity in pregnancy increases the risk of maternal and perinatal complications, and also affects health in the later life, okay, health of the mother and also the child. And this maternal obesity issues is one of the greatest challenges for maternity services in developed and developing countries. Okay, so we're moving to, I want to share about the maternal mortality ratio. So what is the maternal mortality ratio, or MMR? So it is a number of maternal deaths during a given time period per 100,000 live births during the same time period. So it represents the risk associated with each pregnancy. And also it shows the risk of dying once a woman is pregnant, and it indicates the quality of care in terms of antenatal, intrapartum, and postnatal period. So I believe that in to indicate the quality of the care, so it here where the therapist roles on the improving the antenatal and also the intrapartum and postnatal periods. Okay, we can assist on reducing the maternal mortality ratio. Okay, next we're looking at the risk factors of the maternal death. So actually there are more than 10 risk factors of the maternal death. And one of it is the existing comorbidities which leads to the obesity. So here is our roles, okay, the therapist roles to improve on the maternal health of the mom. Okay, so on this graph, you can see and get the idea, the MMR the maternal mortality ratio in Malaysia from the 1933 to 2018. So by looking at the graph, so we know that we are able to reduce tremendously, reducing on the ratio of the MMR, okay, from starting from 1933 to 2018, but yet from 2000s, okay, the year 2000s, and until 2018, it is a plateauing ratio. Okay. So what is the highest causes of MMR? In 2018, it is because of the associated medical conditions. All right. So that's about the complications. Okay. Next, we move to the women's perspective. So this is what I want to discuss, share more this afternoon. Okay, so we are looking on the barriers and the motivations of the women towards the physical activity. All right, so what is the barriers to physical activity? So actually, many women have the intentions to do exercise, but what is the barriers facing by the antenatal women? So the common barriers is the lack of time, too busy, okay, because of the medical problem or socio-economic factors, weather or accessibility to the physical activity or to the gym accessibility. Okay, exercise was uncomfortable, dislike the exercise, or they give the reasons lack of childcare, child preparation time, laziness, excuses, and also the social belief and fear of miscarriage. But in currently, in year 2000s, actually the social belief is the lowest barriers that um, lowest barriers among the antenatal women, okay, compared to the previous years. Okay, so the first I want to share on the barriers in first trimester. Okay, we know that this study is in a Western country because the Asians, we are still lacking of the Asian study on the barriers of the physical activities. Okay, let's see on the graph of this study by the SISMA 2018. Okay, this study is conducted among the US women. So there are three groups, which is non-exercisers, infrequent exercises, and exercises. And from here, it shows that the too nauseated or tired for exercise is the number one barriers, okay, among the three groups. Okay, it is a significant barriers among these three groups. Okay, and also not enough time in the day for exercise, and I'm not a regular exerciser. Okay, the next one is the top three barriers. So this is the study in 2019 conducted among the pregnant women in health club members. So it's actually a difference to the previous study, which is they are looking to the pregnant women itself in the health club members. So they are already aware on the physical activity. So in the first trimester, okay, but the beauty of this study, because they are examines the barriers across the pregnancy, the trimester of the pregnancy. Okay, so on the first trimester, the lack of energy and tiredness is the number one barriers. And we also noted that the second trimester and the third trimester, the lack of energy is the number one barrier among the antenatal women. Okay, for the first trimester, the second barrier is on the pregnancy-related illness. Yes, we know and we know that because of the nausea, because of the morning sickness, so that is the barrier for the mom in the first trimester, and also lack of time. For the second trimester, the second barrier is lack of time and also lack of motivation. And the third trimester is they feel uncomfortable and also they need a bed rest or the physicians told them to get a rest. So that is among the top three barriers. Even though they are already in the health club members, okay, they are already engaged in physical activities, but the exercise was uncomfortable, it's also become a barriers for them. So how we want to encounter this? Okay, next, the study among the Australian women. Okay, okay, so the reasons that the women not exercising. So what is the reasons? It almost similar. Too tired is become the barriers for them. Okay, which in the third trimester. Okay, in this study, they are looking for the pre-pregnancy. Okay, pre-pregnancy, at the first trimester, second trimester, and in the third trimester. So we look at the reasons for not exercising. They are too tired, too busy, and also dislike the exercise. Okay, so this is a qualitative study among the non-exercising pregnant women. So they check among the pregnant women, non-exercising pregnant women. So what is their views and experience of exercise? Okay, there are actually there are 10 more. So I just pick up 6 the highest views and experience among the women. So the number one is starting difficulty. So they feel difficult to start because they feel they are unfit and thinking about it's just not happen to do the exercise. And the second one, because haven't got time. So it is similar to the other study on the barrier of the exercise. And next, on the not reaching the idea of feeling lazy or ashamed. Okay, so this is most common barrier. And then feeling of immobility, feeling unhealthy. Okay, and focus on becoming mother and need support. So I would like to share the positive, okay, almost is negative views, but where I color in red is the positive view of the mom, because it showed that she wants to become an active parent and play with them and so on. So that is the reasons why she engaged in physical activity during pregnancy. So she prepared herself to become an active parent. Okay, so the belief to strengthen the body and be more alert and have more strength, so that they practice exercise during pregnancy. Okay, so we move on. Motivations or motive for physical activity. Okay, so what is the common motivations? Okay, so just now many participants said, oh, because of the baby health. Okay, so the fitness, tone and strength, and also the weight control is among the common motivations. Okay, relieve stress. Yes, the antenatal women to exercise because to relieve stress, to get enjoyment, and also to get stay healthy, and also have a regular routine because they want to socialize. They want to meet with their friends. So that is the motivation why they want to do or engage in physical activity. Okay, so the similar study looking at the motivations, the top 3 motivations, okay, across the pregnancy, the trimester of the pregnancy periods. Okay, the stay healthy is the among top reasons. Okay, but here similar subject, which is the pregnancy in health club members. Okay, for the first trimester, the motivation is also for the weight control and also for the fitness. And for the second trimester, same. And for the third trimester, the relief stress is there has become a motivation to do exercise in third trimester. And reasons for exercising, okay, among the Australian women, so they are exercising because they feel fitness, and also tone and strength and weight loss. And you can look over here that the enjoyment also is the motivations for them in the first trimester. Okay. All right.
Yalah. Yung isaw to.
All right, so we finish on the barriers and all the motivations that women facing to do towards the physical activity. So what is the coping barriers, okay, that we should highlight? Okay, so among the antenatal women, so actually to overcome the barriers, so they need to improve or to increase their awareness in terms of the knowledge and attitude on the benefit of physical exercise. Okay, however, there are still numerous studies also done on the KAP, knowledge, attitude, and practice of physical exercise among antenatal women, which found that actually antenatal women now have the knowledge and also have the good attitude towards a physical exercise. So the problem here is how to practice. So how to emphasize them to become to more awareness on their maternal health. Okay, so that is the role of us on giving them more awareness to become an active during the pregnancy. Okay, the next one is the self-motivations. So they need to get their self-motivations and also the external motivations from the healthcare providers or from the family members or a spouse, okay, or get them to overcome the barriers. And for the social support, okay, so they really need, antenatal women is really needs for the social support, okay, such as the spouse, the families, and also the family members, and also the friends to support them to engage in physical activity. And from the healthcare providers, okay, the support from the healthcare providers, such as advices, motivations, and also suitable interventions is really need to overcome the barriers. Okay, so I put it there an example that which is also suit in this pandemic in the pandemic issue, where we can also provide the exercise video for the antenatal women. Okay, so actually this is the practice is more to the urban, but how about the rural pregnant women, because they are not exposing to what is physical activity, what is the exercise, what is the benefit of the exercise uh, during the pregnancy. Okay, next on the provide health education. So as the healthcare providers, okay, we need to provide the health educations. We have to give them the idea how to modify the exercises, okay, because of their their anatomical and physiological changes. So we have to modify some exercises which suit with them so that they can adapt with the exercises. And also we can switch it to the modalities, okay, and examples for overcome a women's discomfort. So helping the women to find support belts, in example, okay, support belts, or suggesting a variety of the modalities to do the exercise, like the free weights, okay, and resistive bands, okay, exercise balls. That is all the examples of switch to the modalities. And giving the informations regarding exercises. So we give the informations how to do the exercises in more details, and with the explanations of by doing this exercise, so it will strengthen your muscles, and in order to reduce your pain, and also it will allow you to maintain your activity levels. Okay, and also rebrand the exercise. What is the meaning of the rebrand the exercise? Is a way to educate the women, okay, instead of knowing the benefits of the long term goals. So we try to make it or advise them on the benefits of the immediate benefits of the exercise. Okay, like if you are doing this exercise, it will reduce or by doing this exercise, okay, it is can help you to more energy or stamina, and also give a better sleep. So that is the immediate effect that they are looking for, instead of they know the longer goals for doing the exercise. Okay, so what is the significance? So the significance of addressing the barriers and motivations, are we able to understand that difference barrier in each trimester so that we tailor their activity recommendations, and also with that maintain the levels of the physical activity throughout the pregnancy, and also promote the immediate benefits of being active. Okay, so as a conclusion, so exercise during pregnancy is important for maternal and fetal health and well-being, and understand the barriers to educate exercise during pregnancy is very essential to improve the prenatal counseling and interventions, and addressing the barriers to physical activity early may enable more women to exercise consistently through the pregnancy. Okay, so this I share the recent guidelines for those interested on the antenatal exercises. Okay, this is the latest Asian Pacific Consensus in published in 2021, and also you can compare or get reference the Canadian guideline for the physical activity. Okay, so I will finish my terima kasih. Kamsahamnida. Jawab from Malaysia.
Wow. All right. Thank you so much, Puan Nur Farhana, for the enlightenment, and at least we know how far we can go with our patient on pregnancy. Okay, let's go to the question in the chat box. So far, there's no question, Puan Farhana, luckily. But then, okay.
Ada soalan.
Ada. All right, okay, good.
Okay, all right.
Puan Farhana, you got one question from Siti Nur Zafira. How many weeks you suggest to start exercise for pregnant mother and after giving birth? Maksudnya pre and post natal. So how weeks that you suggest? Suggestion for during week ke berapa?
Oh, week. Okay, week. All right. Okay.
And what are the best exercise for third trimester? Okay.
Okay. Where Dr. Azliana? I tried to
Yes.
get to the full screen actually, but I didn't get it. How to move to the?
No, you can close this presentation. Or you want to show the notes regarding the stages or week?
Oh no. Because I want to go to the full screen. How to get
You
it?
want to full screen?
Button
bawah tu, can
now.
you go to?
The button. All right.
Kakak kau sharing kau, ni sharing kau. Apa? Tadi.
For
Okay.
other.
Okay, for the questions from Zafira, right? Okay, so the recommended exercise is actually at the 12 weeks and above, because we try to minimize the problem, especially during the first trimester because of the morning sickness. But if the woman is already physically active before the pregnant, okay, so it can she can start the exercise as early as she can, if she can manage. So that is for the answering the weeks, right?
Number 1.
Okay, then the week is after delivery, right?
Yes, the postnatal.
Okay, so the suggestions for the post delivery is actually 6 weeks, because that is the preparium period. Okay, so after the 6 weeks, okay, means tempoh pantang lah kan. So the pantang after the 6 weeks, so the women is actually slowly can start the exercise with the slowly with the low intensity and progressively towards the moderate intensity.
Right, okay. Thank you. And then the same question from Siti Nur Zafira also. What are the best exercise prescription? I mean exercise prescription for third trimester or any exercise? What exercise training for this pregnant woman at third trimester?
Okay, for the third trimester is actually the barriers is because of the uncomfortables, because we know that the tummy is become larger. Okay, then we feel very tired to do the exercise. So the best exercise is actually we can carry on the exercise from the second trimester, but we are more focusing on the strengthening on the pelvic floor and all the in preparing for the labor.
Yeah, and also believe for breathing exercise pattern,
Yeah,
right?
and
Concentrate
also
on the breathing also. Yeah.
Yeah, and we are
Okay.
encouraging them, if no contraindications for the contraindications, okay, like the medical problem, so the women can training on the squatting. Squatting is a good exercise actually, but squatting with holding the chair or holding with the support lah.
All right, clear. Next question from Nazim Soleh. He want to ask regarding what happened to a pregnant mother that avoid exercise during maternal period.
Okay, so actually in this meantime, there is no more fears of the exercise, because it is already know that the exercise no harm to the mother and also for the fetal. Okay, that's why for the mother that avoid the exercise, we have to give them some motivations. I think the motivation is they really need a motivation, and also the support from the family members and especially the spouse lah, on encouraging them to.
So should be they perform exercise, but if they don't perform an exercise, there's no harm. But then the intergeneration effect don't take place, right?
No. But we
So
have to take care. We have to take care actually our diet, exercise, and also the stress.
Yes, also believe that a baby is a reason, not an excuse, right?
Yes, definitely.
Okay, next from Mira Faisal. If there any contraindication during performing exercise that may for the mother and for baby health, what the contraindication? And
then contraindication.
common contraindication during performing an exercise. So what we can take precaution, the do and the don'ts.
Okay. So
Is that
usually
your answer, Mira Faisal? Okay, tak
So,
apa. Okay, nanti alright.
So I think she want to know when to stop the exercise, right? Is it the signs
Is it the types of contraindication that might have for mother and for baby during exercising?
For mother and the baby. So for the mother and baby, does it mean if the mother is really have the medical problem
Issues, yes.
Yeah, issues, that is the contraindication. Definitely the contraindication, like the placenta
Okay, such as?
placenta previa. Okay.
Yes.
Okay, that is one lah that come across my mind now. And to actually when the mother involved or engage in the exercise, we can monitor them by giving the signs on when to stop the exercise, like bleeding or leaking of the fluid. So that is how they monitor themselves. Okay, so when we advise, so they do the exercise at home, so they should monitor themselves where to stop and what is the suitable level or intensity that they should able to do.
In terms of contraindication for baby health, any example for that?
For the baby health, if the mother is clearly know that they are having the problem with the
Any congenital defects or
yeah,
something. So
yes,
they may need to seek for other medical advice, right?
yes,
Before they continue to perform any exercise.
but the
Okay.
the very light physical activity I
Should
think
be no harmful, right?
harm for the and baby.
All right. And then next from Siti Nozafira, and which type of mother not allowed to do exercise? I believe this question, what
Already
the contraindication,
yes, all the
what
contract.
type of mother? I don't understand. What type of mother? Or maybe they focus on the
Mother with
precaution
the
or the
medical.
contraindication. Yes, mother with any medical issues lah. All right.
Okay, actually, Dr. Yana, to more details on the recommended or the guidelines, so Zafira can refer to the latest latest guidelines that they already published.
Can you share
For the
the
issue
link for that after this, Puan Farhana, so our participant can go through for the latest guideline from?
the latest guideline, the articles, which is the guidelines that they are the guidelines for the Asia Pacific. So for the Asian country lah.
All right, okay. Next, also another question, please stay with us. From Shelina Bakrizin to everyone, they suggest picture or type of exercise for starting safer start second and third trimester and post cesarean. Suggestion picture of exercise. What do you mean by that?
Suggestion features.
Any question ke suggestion? Suggestion, I think this is suggestion for physiotherapy. For that, kalau physiotherapy approach any patient, so you can put a picture. Yes, this is good for education actually. Next, from Hamida. Next question, how immediate the mother can do Kegel exercise after vaginal birth, after delivery, for normal delivery?
Okay, for the normal delivery, it's actually same like the Kegel exercise. If not much what we call tear, okay. If the mother it is actually refer back to the 6 weeks after the delivery. But if the mother feel that it is comfortable, because maybe some mothers after the delivery they are not more tear, okay, or I mean the lacerations or tear in the vagina, so it can start by contracting
as early as 6 weeks lah, as early as 6 weeks if they have no complication. All right, Ken. Good, clear with that answer. And then from Monica, I believe this is last one or ada lagi, never mind. Last one from Monica. What is your advice or opinion or experience in monitor the mother's physical activity level? Can we use outcome measures such as PPAQ, Pregnancy Physical Activity Questionnaire, in monitoring their physical activity level? Or is there any common outcome measure can be used that practical for this population?
Yes, the PPAQ is the established outcome measure to use for the physical activity, to monitor the physical activity. So that is the recommended.
Other than that,
and also the PPAQ is also have the Malay version actually.
So it's okay. It's applicable for our Malaysian context, all right? They have Malay version also.
PPAQ.
And as visual, you can use that. Good, interesting. And last question, from Azu ID. Okay, Azu ID claimed that he or she, so many times that she saw about pregnant mom that done the hardcore exercise. Okay, such like use high level dumbbell and so on. Is that okay from them in terms of individual? I just can't interfere because they seem know what they are doing. Oh, okay. Might be they believe that they know.
Okay, so
you get the
actually
question? All right.
For the mom that is already active before the pregnancy, so they are encouraging to do the vigorous intensity. Even you can see the guidelines also. Okay, the recommended is moderate intensity, but if the mom is really physically active, so they are
Before.
encouraged, yeah, they are encouraged to do the vigorous intensity actually. But
Alright.
for the third trimester is not they have to be careful during the third trimester.
Alright, okay. So I believe that's all for Puan Fana. There is there any last word from you regarding your topic? So I believe this all answering your question.